I would. I'm from Humble, Texas, and I would like to ask the panel of their opinion of weight loss surgery for the improvement of health.
Well, since I'm in the obesity business, I guess I ought to take that. And the short answer is it works. It does work. But 1/3 of the patients who undergo obesity surgery and get an estimated 30% excess weight loss actually gain it back. And the question is why? Why does 1/3 of the patients end up not benefiting? The answer is because they're not screening properly for what the problem is. There are lots of reasons for obesity. One of the reasons for obesity is food addiction, and very specifically sugar addiction, because sugars really and caffeine are really the only two items in food that you can be addicted to. They're the only things that actually stimulate the reward center in the brain and generate a dopamine response, which is basically, the hallmark of the addictive response. That addiction is not going away because of weight loss surgery. And so a lot of people end up having weight loss surgery and becoming alcoholics in order to stimulate that nucleus accumbens instead, or start smoking, or they go back to sugar and they drink their calories instead of eating them. And so, if the patients are screened properly and provided with appropriate post-op care, which a lot of weight loss surgeons don't even do. So you have to do it in an organized professional program that has post-op follow-up. If it's just a cut and run bariatric surgeon, stay away. Do not do it. But if it's an organized program at an academic medical center with appropriate social support, and they've screened you properly for addiction and for psychiatric and psychological and abuse, adverse childhood experiences and abuse issues, it does work.
But does it work as well as losing weight through other means?
Depends on the patient. Depends on the patient. There are patients who, because of either genetic influences, because of FTO, because of the gene that increases both food intake and reduces expenditure. There are patients who do better with bariatric surgery. It's not a perfect science, but we have a lot of screening tools that are available to try to pick the right patients for bariatric surgery. We used to do this at UCSF. I used to refer patients, for bariatric surgery at UCSF, and we actually had good experiences with it.
Leota, would you like to ask a question, and where are you from?
Yes, can you hear me?
Yes.
Okay, good. I learned to work this thing. Anyway, I am 81 years old, and next Wednesday I'm scheduled for a colonoscopy. Basically, I'm really good health for my age. I'm active and basically plant-based diet, basically. And I was wondering if they are safe. Should I go ahead with this? I've had a in my lower right abdomen. It can come on suddenly at night, and it's very sharp, probably on the 8 pain level. Do you think this would be good for me to do this?
I think you need to take the advice of your doctor. This is not a screening colonoscopy. It sounds like you have a complaint and that the colonoscopy is being done to investigate and possibly treat that complaint. No surgical procedure is 100% safe, and even keyhole procedures or colonoscopies have so many percent things that can go wrong, but they can also provide you with benefit. It's a way of seeing into you to find out what's causing your pain. So nobody would guarantee any surgery, But colonoscopy is a recognized treatment to treat people with complaints, which is different to screening people who have no complaints, which is not your case.
Do you recommend screening colonoscopies?
No, I'm not up on the literature with that. Others may be, but the evidence for it isn't as good. I know I see it on in America. I think it's big business, isn't it? I mean, people get colonoscopies done regularly over there, but I'm not sure of the evidence that that's helpful in otherwise healthy people. Other panel members?
I think the evidence shows that colonoscopy is one way to screen for colon cancer, and the looking for occult blood is another way. And I don't think that there's a statistically significant benefit in colonoscopy to the non-invasive tests.
Yeah, but in this particular case, though, this is not a screening one, so I just need to point that out to Leota.
Yeah, and
wrong.
Dr. Harris, I agree. I think your answer is eloquent to Leota. But one thing, Leota, that you might want to consider would be to get a second opinion from another independent gastroenterologist and see if another doc listening to your story and listening to the pain that you're having comes to the same conclusion. If you're uncertain about it, that would be the way to handle it intelligently.
Yeah, I strongly recommend second and third opinions. The studies looking at second opinions have shown that the second opinion very frequently doesn't line up with the first, unfortunately.
I'd like to ask each of you gentlemen to make a 30-second closing statement just to sum up any final thoughts that you want to share with us before we close out for the evening.
I'll go first. Look, thanks for having me. I don't really have anything else to say, except I think the audience is already a little bit skeptical about a lot of medical procedures, but ask the question, what is the evidence that if I have this, I will be better than if I don't have it? It's a very simple question, but that's the question I would ask of the doctor.
And how do we follow up with you, Dr. Harris, if we want to get your book, if we want to stay in touch with you? What's the best way for someone to stay in touch?
You can find me on the internet, through my university appointments and things like that. The book is, thank you, very well advertised online there, and it's available, Amazon and everywhere else. So it should be pretty easy to get.
Okay, and if someone wants to find you, they can also go to our website, to your bio, and click on that. And when they click on it, it will take you to a page that gives your website address and other information.
Thanks.
And if they want your book, they can go to Amazon or they can go to our bookstore and click on your book. So thank you.
Thanks.
I guess I'll step up next. We've focused, this has been an excellent discussion, and we've focused more on the negative side of medical care than the positive side. And I think it's important to remember that there are good doctors and some medicines work. And the challenge for all of us, patients and doctors, and us doctors of patients as well, to be intelligent critics of the healthcare system, and to remember that medical science has provided some wonderful benefits, and we don't want to cut ourselves off. We don't want to throw out the baby with the bathwater.
That was great.
It shouldn't be this hard. It is this hard, but we don't want to forego the benefits.
And
Yeah,
how would
sorry, go ahead.
And how would someone stay in touch with you, Dr. Abramson, if they want to get your book, if they want to follow up with you? What's the best way?
I would say exactly what Dr. Harris said. I'm not a good social media person, and I will give you my email, Steve, and people can write to me, and I'll respond.
Okay, and let's see, if they go on our website and click on you, it has your bio, it has your phone number there, doesn't have an email, but has some other information for you.
Well, let me send you the email so that you can update it. I'd much rather get an email than a phone call.
Should I read your email right now? I do have it. Should I read it?
Sure.
Actually,
yeah.
Actually, if you go on our website and you click on your bio and go to your website, it says email, and if you click on it, it brings up your email. So we do have it already on our website.
Great.
Okay,
Thank
good.
you.
Okay,
That was a great statement, Dr. Abramson, and you sort of took the words out of my mouth. And I want to remind the panelists that Dr. Abramson understood a lot of this stuff 20 years ago, before any of us understood any of it, I think. Certainly before I understood any of it. I think a lot of the problems today are our medical treatments are applied indiscriminately rather than using sort of the art of medicine. And it just makes the patient, they have to step up and they have to do their due diligence. And it's not an easy thing to understand. It's hard for us to understand. But you can learn about it from reading books like ours. And you can get a hold of me through robertyohoauthor.com, or I have a Substack blog, and you can subscribe to that at robertyoho.substack.com. Thank you.
thank you.
I guess that leaves me to clean up. So I'm just going to quote the first sentence of my book. There's a wasp in your attic. What do? Kill the wasp or destroy the wasp's nest? In order to solve a problem, you have to work upstream of the problem. Working downstream of the problem only fixes the result, not the cause. The cause is still there. And so if you kill the wasp, the next time you will be stung into submission. Ultimately, we in medicine have lost sight of this. We are working downstream of the problem. We are treating the symptoms of the problem. We are not treating the cause. We're not taught how. This is a systems biology issue. Medicine is the ultimate application of systems biology, and we don't even know what it means. In response, we have to reform the medical system. And unfortunately, that's a really tall order for all the reasons you've heard about tonight. I'm dedicated to fixing it, to bringing this to, shall we say, the attention of the public, who will ultimately apply pressure to get this problem fixed. But there are a lot of people right now making a lot of money off it. And so I'm glad that you all were able to attend tonight to listen to what the issues are. And hopefully you'll apply some pressure on the powers that be, your congressmen, your legislators, to try to, move the needle over the course of time. This is a generational shift that has occurred. It's going to take a generation to bring it back, but I'm confident eventually it will come back and realign. But it's going to take everyone working together.